السلام عليكم. أنا هاني عوض، أنا مدرس جراحة مخ وأعصاب جامعة المنصورة. First of all, I want to acknowledge this work for Dr. Yasser Al-Banna, who is my supervisor in my thesis, and Dr. Bassem Awad, our colleague in Mansoura University Department of Neurosurgery, who is my elder brother and the godfather of this study. We will not talk a lot about idiopathic scoliosis from scientific point of view. We just express our building up experience in the past few years about adolescent idiopathic scoliosis and other spine deformities. Scoliosis comes from the Greek word scoliosis, meaning crooked. It's a complex three-dimensional deformity of the spine characterized by lateral deviation of at least 10 degrees with a rotation of the vertebra, usually associated with reduction of normal kyphotic curvature of the spine. Correction of scoliosis in a 3D manner is the target of this type of complex surgeries. Okay. For patient and demonstrators, this study was conducted in Mansoura University Hospital between July 2020 and October 2021. 3D surgical correction was performed for 28 patients complaining of idiopathic scoliosis and not responding to conservative measures and not associated with any neurological affection. Our inclusion criteria was age between 10 and 18 years and the coronal curve measuring more than 45. For a patient evaluation, complete history, including family history of scoliosis, is obtained. Patients were assessed clinically, especially with neurological examination, locally in standing position, and by Adam forward bending test to detect any abnormal curve rotation, rib hump, shoulder, and hip asymmetry. Symptoms of pain and or weakness, and generally for detection of associated medical or surgical comorbidities during the examination, height, weight, and age are recorded. This is Adam forward bending test for one of our patients showing a high rib hump and waist asymmetry. Radiological evaluation depends mainly on plain X-ray radiograph, as it's a main radiological tool used for evaluation of AIS cases, posterior, anterior, and lateral 36, 14-inch standing long cassette views from occiput to mid-femur are obtained, then lateral bending to assess Cobb angle, razor sign, and the flexibility of the curve to differentiate structural from non-structural curves for classification and operative planning. This is a photo for our X-ray for long-standing AP and lateral bending on both sides. Then we do a CT scan for observation to assess the degree of vertebral rotation, measuring pedicle size and the vertebral body length in axis view for sclerosis erection, and this was done for all cases. MRI is not routinely used, but it's indicated with presence of neurological symptoms present in patients with idiopathic scoliosis and left-sided sharp angular or irregular curve patterns. This is our procedure. The procedure is performed under general anesthesia and received antibiotic prophylaxis. Patient will place the prone position to ensure that all pressure points were bedded to prevent pressure neuropathy. This is a view of the position of the patient and our markers over the levels of the spinal fusion. After that, all procedures were performed using somatosensory electropotential, motor electropotential, electromyographic monitoring. Patient was prepped and draped in a sterile fashion. All surgeries was performing using a posterior midline incision with subosteal muscle dissection. Then patient underwent posterior laminotomies, facetectomies, posterior pedicle screw fixation with Medtronic style. This is a picture of intraoperative photo for subosteal muscle dissection. And this is a close one for subosteal muscle dissection of one of our cases. After that, this is a screw placement and multiple osteotomies and facetectomies. Okay. This is another view after facetectomies and laminectomies. Then after that, intraoperative platelet sclerosis was confirmed with trigger telectomogram, intraoperative fluoroscopy, or upright AP and lateral radiographs. As you see, this is after screw insertion. After that, next step is deformity correction, trying to do a DVR, direct vertebral rotation, and compression and distraction for better correction of the curve. This is another photo, intraoperative photo, while doing correction of the curve. This is the final photo after correction of the curve and rope placement. As you see, there is a marvelous improvement of the curve. This was confirmed radiologically after correction, and this after replacement, showing in the upper row, showing in the AB and the lower one showing screws in the lateral view. And I want to highlight that we do differential rod bending, okay? After that, an intraoperative wake-up test was performed on all patients immediately after curve correction. A final step of bony decortication and allograft. We don't use iliac crest, and the synthetic graft are used and placed for bone fusion. Is a photo after decortication and putting bone substitute. This is after the reconstruction in anatomic manner and closure of the skin. Okay. Post-procedure care, all patients were placed in the pediatric neurologic intensive care unit after surgery. On the first day after procedure, all patients was encouraged to ambulate or at least to be up in chair for meals. The reins were removed for between 2 to 5 days after the patient's last procedure. Standing anterior and posterior standing scoliosis radiographs are immediate post-operative height are obtained for observation before discharge. Then we repeat standing radiograph at 6 weeks, 3 months, 6 months, and 1 year after surgery to assess alignment, preservation of curve, and hardware placement. This is the post-operative of X-ray of one of our cases. Okay. Results of our demographic data. The study was conducted for 28 cases with mean age of 15.1 plus or minus to 1 years and range between 11 and 18 years. Among the cases were 6 males, 21%, and 22 females, 78%. 79, sorry. Patient classification according to Linky, there was 16 patients with type 1 care, 4 patients with type 2, 3 patients with type 3, 1 patient with type 5, and 4 patients with type 6. Concerning the Cobb Angle, the preoperative Cobb Angle for these cases was 42 to 81, and the mean was 51.8 plus or minus 8.4. Mean post-operative curve was 8, ranges from 3 to 25, with significant decrease in Cobb Angle immediate and 1 year post-operatively when compared to the preoperative level. After 1 year, Cobb Angle was preferred with no significant change from immediate post-operative level. Concerning immediate height gain, mean preoperative height was 1.6 meter, ranged from 1.37 to 1.77, while mean postoperative was 1.66, ranged from 1.46 to 1.83, with significant increase in height postoperatively. Mean percentage was 3.91%, ranged from 1.16 to 7.58. Concerning the association of height gain with Linky classification.
ممكن بس يا دكتور هاني
سريعا اوكي
عشان الصلاه
اوكي Okay, we can skip all of that. I will just show you 1 or 2 of our cases. This case 1, the patient of idiopathic scoliosis. This is a preoperative, okay, X-ray, AP and lateral, showing the curve here and the rib hump on the other side. Okay, this is the lateral bending, and this is the Adam bending forward test for this case, and this is the immediate post-operative X-ray. And this is post-operative. Okay, this is another case, and this is our first case of adolescent idiopathic scoliosis done in 2018. Okay, and that's another case. And the last one case of Linky 5 with good post-operative correction. The last case is Linky 1. Okay. So we conclude that analysis of patient with idiopathic scoliosis was care more than 45, treated with posterior spinal fusion and minimum 1 year follow-up, with a success rate of 78% of all lumbar curves and 83% of all thoracic curves. Thank you so much.